Are you able to explain how you know that I have a cyst? Because there isn't a lump under my skin. It just feels flat and feels normal. Right. I know the context of this. You don't. So you're probably thinking that's a weird question, but I do know the context. And the context of this is a patient who had showed us a photo of a cyst, a red lump. And I said, oh, that looks all red. That looks like it's infected. Wouldn't be able to remove it while it's all red and infected. So we can't remove it. And so then a couple of weeks later, they sent another photo saying, oh, it's gone. It's basically gone. And I said, well, now's the time to remove it because it obviously was a cyst, but it's just now gone quiet and has burst or whatever, and the infection's gone and it's settled down. So now they're saying, how do you know I've got a cyst? Well, the reason I know they've got a cyst is because they sent the photo a few weeks before with a big lump on their face, with a big red lump. So obviously, if you've got no lump and you can't feel anything, there's nothing there, there's no reason to believe you've got a cyst. But if one day it all balloons up and then that balloon goes, I mean, we'd have to examine you in clinic because usually you can feel something in the clinic. I mean, if you genuinely can't feel anything and you can't quite remember where it was, I mean, obviously you've got a photo, we might be in trouble if there's really nothing to feel, but you can usually feel something even though the cyst is kind of deflated, because what we need to do is we need to remove that cyst wall, because if you don't remove that cyst wall, it just comes back again. And the time to do it is when it's quiet, not when it is red and angry and swollen. So so the reason I know there's a cyst there is because of the photo a couple of weeks later with a big lump on your face, which is all red. So as I said, we'd see you, and if there genuinely was completely nothing to feel, nothing to see, and it's all fine, then yeah, okay, fair enough, you could leave it. But just keep an eye out, and if it does start to sort of swell up, you want to get it when it's small if possible, but also quiet. So you don't want to have skin red, inflamed, because we won't remove it then. We have to wait for it to be quiet.